Hi, I'm Melissa Scott. I'm your Premier Rep. Congratulations on the purchase of your new cordless hygiene handpiece, the AeroPro. I thought I'd make a tutorial video just to kind of introduce it to you, go over registering the warranty on it, key features and benefits, and just kind of talk you through how to use it. So the first thing you do when you receive your AeroPro is I want you to get out this quick start guide. There's great information in it to just get you started, but flip to the back. On the back is the warranty registration information. It gives you the website to go to register this. It's very important that you get that warranty registered. Your handpiece has a 3-year warranty and a 1-year warranty on the battery, so go do that first. The next thing you're going to do is unlock your handpiece. It comes in a locked mode. So you're gonna see a green piece of paper on that, take that off, and then hold the button down for about 3 seconds, and you're gonna get 6 beeps, and it's gonna flash. That's gonna tell you that your handpiece is now unlocked. So now you're ready to use your handpiece. Let's talk about it. Notice that I put a competitor's angle on this handpiece. Because guess what? You have the choice of profi angles that you want. You can use whatever you want. Another cool thing is that now your profi angle will rotate. It's much easier on your hand ergonomically. That way you're not having to move your wrist like this. You can just position the profi angle wherever you want and position it in the mouth where you need it. So another thing that you know about this is there's no rheostat. And Premier designed it that way for a couple of reasons. First of all, mobility. It is so much easier to be able to jump from room to room without remembering to get your rheostat or having to pick up that dirty rheostat or kick it to the next room. This is all you need. So mobility. The other reason that Premier designed this handpiece without a rheostat is for ergonomics. I practiced clinical dental hygiene for 17 years and had to put my instruments down, put my scalers down because I was having really bad back issues. There are a lot of reports coming out now talking about the ergonomic issues of using a rheostat all day long and how it affects your lower back and hip. So you don't have to worry about that with this. Okay, so to use it, all you do is press this button. This activates and controls the handpiece. I prefer holding it like this and using your thumb to toggle through the speeds on the button. Some people I've seen using their index finger. The thing that concerns me about that, once again, is going to be ergonomics. I worry about your tendons right here over time maybe getting sore. So try using it with your thumb, and it will be more balanced in your hand too. So to turn it on, all you do is hit the button. There are 3 speeds. Low, which by the way, I want you to notice how quiet it is. One thing that stood out to me about it being so quiet is this is great for any pediatric patients that may have sensory disorders. I started seeing more and more patients that had sensory disorders, and this stood out to me. It's great, that's very quiet for them. Then you can quickly toggle to medium speed or high speed. And another thing, notice how easily it is to toggle through. I've seen some people slowly switching speeds. You don't need to do that. It's just quick, 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 and it'll toggle through the speeds. Now to turn it off, all you do is hold the button down for a 1 Mississippi count. Boom, it's off. That's it, super easy. What you want to do when you need more profi paste, I want you to make sure that you turn it off, that 1 Mississippi, that's it, to come out of the mouth to get more profi paste. That will prevent saliva and profi paste from slinging all over you and all over the patient's face. Just make sure you hold it down, that 1 Mississippi, before taking it out. Now, I want you to take this sheath off, and I want you to feel with your finger right here. That's actually where the button is. It's not on the sheath. It's not right here on the silicone area. It's in here. That will help you orient where your finger should be. I've seen some people trying to push the button on the side. That's not it. You want to push it straight down, and that's a little key little key tip that will help you. Another cool thing about this handpiece is you can program it to 2 speeds or 3. To change it, right now this one is programmed on 3. To change it to the 2 speed, you want to make sure the lights are on, and then hold the handpiece, the button down for a couple seconds. And it'll beep and light up. It lit up 2 green lights. That tells me we're on 2 speeds. So then low and high. A lot of hygienists like that, just the 2. Now, turn it off and let's go back to 3 speeds. So hold it down for a few seconds and it 3 beeps and 3 green lights. That tells you you're back to the 3 speeds. And that I've seen some clinicians get a little confused about that, so I wanted to make sure you got that. Okay, let's talk about sterilizing this. This sheath is what is supposed to be sterilized. It should be sterilized between every single patient. That is what makes you CDC compliant. Now, your handpiece is going to come with a box of 500 of these barrier sleeves. This should absolutely be used between every single patient. There are some companies that are saying that their handpieces don't need this barrier sleeve. That is incorrect. Think about it. You technically should still be using these barrier sleeves on your air water tips and on your suctions. There's no difference with this. On any handpiece, you should still be using a barrier sleeve. So make sure you use this in between every patient, change it out, and then when you're done, take this off and wipe it down with a cavi wipe. Let's see. This is the charging base. You do not have to start charging your handpiece. You can set it in any direction. It doesn't have to connect anywhere on the base to start charging. It just set it anywhere and it'll start charging. It has what's called a Charge Smart battery. So you can charge intermittently throughout the day. It will not drain the battery. Also, once it gets to 100%, it will stop charging. So once again, it won't drain the battery. Another cool feature is that here, this lighting shows you where your battery life is. That way, it doesn't just die on you. You know where you are. Your handpiece also will come with this stand. This is just a holder for your handpiece. You can use this if you don't want to rest it on your tray, on your patient tray. This is autoclavable. The charging base is not. You can wipe this down with a cavi wipe. Another thing to note about your handpiece is there are 3 O-rings with it. There are 2 right here that allow your prophy angle to rotate. And then there's a 3rd one right here. Your handpiece, the box that it comes in, will have some O-rings and a little key that will help you change them out. I always just use an Explorer, kind of like I use with changing out my cabochon tips. I can't tell you how long your O-rings will last. It just depends on how many patients you're seeing, the volume of patients, but I would say anywhere from 6 months to 12 months, once again, depending on the volume of patients that you see. So lastly, I know that for some hygienists, switching from no rheostat to controlling with the thumb is a change in skill, and it will take some time, but give it about a week, and I think you are going to love it. It's going to change your world. It's going to help your back and your hip. But please, if you are struggling with it, give it a solid week to work through that. I also want you to feel that you can contact me at any time. I am your rep. Reach out to me. Call me, text me, email me, whatever you need. My cell phone number is 817-528-0250, and my email address is M as in Melissa, Scott, SCOTT, @Premusa.com. Again, congratulations on the purchase of your new cordless hygiene handpiece, the AeroPro. I know you're gonna love it. Thank you.